Good morning, everybody. Good afternoon, good evening. This is Heidi Reynolds. I'm the director of the Data for Impact Project, or D4I. D4I is a cooperative agreement with the United States Agency for International Development, or USAID. And we started in September and will run for 5 years. We focus on building evidence using data to inform policies and programs and to strengthen capacity of local partners. It's my pleasure that we can host this webinar titled Beyond Assessments, Capacity Strengthening Experiences of Local Partners. This is actually the second webinar in what is now becoming a series. The series is an effort to support discussions and sharing and learning about effective approaches that support countries in their journey to self-reliance. The first webinar in April 2019, my colleagues at JSI, Palladium, and Measure Evaluation described experiences adapting and applying tools and approaches to assess capacity and plan, implement, and monitor capacity strengthening interventions. A recording of that webinar can be accessed at our website, which is www.dataforimpactproject.org. Today in our second webinar, my colleagues Kevin Sikwabele, Ambrose Egweyu, and Stephanie Watson-Grant will share their experiences identifying opportunities for institutional strengthening with their organizations in Kenya and Southern Africa, and approaches that they use to build technical and institutional capacity in order to prepare themselves to apply for and manage direct awards from USAID or other donors. And we're happy to report that we'll have a third webinar in this series, which is scheduled for July 18th. Which will be held in French and will provide opportunities for our colleagues in Burkina Faso, Cote d'Ivoire, and Ghana to share their experiences and approaches strengthening their institutional capacity. I would also like to take the opportunity to acknowledge and thank my colleague Erin Lubin, who's the Deputy Director for Data for Impact, and her efforts helping to organize the webinar, and to Erin and Ashley Straley, who's our monitoring, evaluation, and learning lead, to help for both their help in conceptualizing the scope of the webinar. So as Chris mentioned, if you have any questions or comments, use the chat box and we'll address them at the end. And you can, and we'll be happy to do that at that time. Okay, we're gonna start with Kelvin, and then Dr. Ambrose will go, and Dr. Stephanie Watson-Grant. I'm going to do their introductions right now so that we don't lose time in the transition. So to start with, Kelvin Sikwabele is a health informatics and M&E specialist with 15 years of experience in health, governance, and gender sectors across Southern Africa. He's a trained demographer and has a strong track record in providing extensive support in management, health system strengthening, including policy development, human resources, and contracts management. He's got experience in training, program technical experience, and research on sexual and reproductive health, including family planning, gender, HIV and AIDS, and education. He has managed medium to large multi-country projects funded by USAID, the World Bank, UN agencies valued at approximately $3 million annually over the last 3 years. He provides oversight for teams of greater than 20 technical administrative personnel and has excellent knowledge of USAID contract management and associated rules and regulations for the management of USAID funded programs. And Dr. Ambrose Egweyu, he's a pediatrician and epidemiologist currently serving as advisor at HealthStrat in Kenya. Based on competitively awarded funding for training, research, and project grants, Ambrose has developed a 10-year career in the fields of monitoring and evaluation, infectious disease epidemiology, and health service research, focusing on quality of care for hospitalized children. Nationally, Ambrose sits on the Kenya Ministry of Health Child Health Expert Panel, providing independent technical advice to the ministry on child health priorities. He was also recently nominated to chair the Child Health Accountability Tracking Technical Advisory Group, or CHAT, one of 3 teams convened by WHO and UNICEF to provide recommendations on a standard set of harmonized indicators for tracking the continuum of care from pregnancy and adolescence. And thirdly, Dr. Stephanie Watson-Grant has over 17 years of experience in public health and development, with 14 years of which was working with organizations at the country level. Dr. Watson-Grant led Measure Evaluation's efforts to develop capacity building planning guidance, developed a framework and tools for assessing evaluation capacity, and applied the tools in 5 countries. She serves as the Director of Field Operations for Measure Evaluation, where she leads a team of country portfolio managers who provide oversight to 36 country operations. So thank you very much for joining us today, and I'm going to turn it over to Kelvin to go into his program. So Kelvin, go ahead and share your screen. Wonderful.
Thank you, Heidi. I hope you can hear me.
Yes, we can.
Perfect. Thank you. Thank you, Heidi. Thank you, Erin, for the opportunity to share with colleagues that want to learn more about these kinds of experiences as you've outlined. I think for me, D4I is an exciting initiative following on to what Measure has done in this space. For those who are listening, as has been introduced already by Heidi, my presentation, just to help you already have a perspective in mind, is not going to focus on the technical aspects of the work that we do. Instead, I will highlight the work that we did in building our capacity to become a direct recipient of USG funding. More information about IHM itself can be found on the internet at www.ihmafrica.org. The first slide has my email. Please feel free to reach out to me in case you've got more information about IHM as an organization and any further questions that you may have outside this presentation. So there's 5 points I'm going to talk to this afternoon. It's afternoon my time. I know it's morning in the US. I'll quickly just share a bit about our organization to give context in terms of what I'll be highlighting. And then I'll quickly move on to talk about the kind of capacity assessment that was conducted, and then the results that were established thereof and how we responded to those results. And then I'll quickly highlight the successes and challenges and then share my parting thoughts to colleagues that may be on a similar trajectory like we did. So briefly, IHM was established in 2011. We are currently headquartered in Swaziland, which is now called Eswatini, but we have country offices in Lesotho, Zambia, and we're trying to establish a presence in South Africa again. We're a not-for-profit organization, working primarily in the 2 areas that I've highlighted there, health informatics and in surveys and research. In terms of health informatics, there's 3 subcategories that we've developed expertise over the past 8 to 9 years. So we work in health information technology, providing both software and hardware solutions to governments in the region. In Swaziland, for example, we've developed the country's first electronic health record that has patient-level data, and that has just unlocked all kinds of analysis that were initially impossible to do with aggregated data, and it's been exciting in that regard. In Zambia, we've developed a data warehouse for the Ministry of Health that has also changed the way in which the country is utilizing data. Then in terms of monitoring and evaluation, our focus has been to increase the range of information products in these countries beyond the standard reports that we're used to, things like UNGAS reports, NASA reports, PEPFAR quarterly reports. So we work with these countries to improve their capacity to generate reports that they can use locally to improve the way they program. And then finally, around data management, one of the things that we've done is to raise awareness around the importance of things like data warehousing and how that changes the way countries manage data and improve how they engage and utilize it. On the other hand, we've also developed capacity to collect data for large surveys. We've been working primarily with the World Bank in this area, both in Zambia and Swaziland. So with that brief background, let me just dive into what I'm going to share with you today. So from 2011, IHM undertook a journey to become a direct recipient of USG funding. We envisioned a situation where we would grow the number of local organizations that are funded directly by becoming one of those organizations ourselves. So from the onset, when we established IHM, we were very clear. We would like to be able to compete directly for awards at the local space. And I think with the kinds of changes that we are seeing and the directions, policy directions that we are seeing within OGAC and USAID in particular, it's exciting that when we set out initially, we didn't anticipate that there would be very bold statements that would be made in this regard. And so in 2011, when we were established, we were quite fortunate to be brought under the wing of then the Building Local Capacities project that was implemented by MSH. Some of you may know this project. And so from 2011 to 2014, we worked with MSH to basically get us to be ready to become a direct recipient of USG funding. And one way they did this was to conduct an organizational capacity assessment for IHM. So when we started out in 2011 with them, it was basically a pre-test that they ran. And then at the end of it in 2014, they ran another test again and they were able to compare the results. The assessment itself, for those of you who are familiar with MSH and the work that they've done, it's really a traditional OCA that has several areas that are ranked. It's self-administered, but it's done in a collaborative manner with the organization that's implementing the tool. In this case, it was MSH. So we self-assess with their guidance and their adjudication, and then the results thereof are shared, and then we build an institutional strengthening plan. It's largely qualitative in focus and is biased towards looking at organizational systems that help an organization to be ready to manage USG funds. It has a technical component that they did run with us, but the findings from that assessment showed that there wasn't much to be done in terms of technical areas. The focus was more on the operational side of things. So having run that assessment, what did MSH come up with and what did we find ourselves? So I thought I would highlight 4 critical areas that came out clearly that we were required to work on in the 3 years that we worked with MSH. And these are HR, finance, governance, and tech. So specifically under HR, MSH was able to advise that our policies that were in place at that time needed to be updated, specifically around the way we recruit our people and the way our remuneration was structured. So when IHM was established, what we did was our recruitment and remuneration policies were simply based on your salary history when you come to the organization. But what we did then was to restructure that element and make sure that we are in line with industry practices. Again, when it comes to becoming a direct recipient of USG funding, there's a lot of emphasis on USG rules and regulations. We didn't have that kind of formal training in that area. But also in terms of sustainability going forward, a key concern for IHM was our cost recovery processes. These were basically non-existent at that time, and they were flagged for development. By the time we established IHM, we had made a decision to have a technical board in place as opposed to a governance board. And that's because we are not an NGO, we are a not-for-profit organization. So Swaziland's legislative environment allows for these kinds of organizations to be created. I think in the States, what is similar would be what you call private voluntary organizations. So we strategically didn't want to call ourselves, to identify ourselves as an NGO, but also we knew very clearly that we are not a private company. And so there's this space that allows us then to be called a not-for-profit. And that's what allowed us to set up a technical board. But regardless, the advice was that we're supposed to put together a governance board to help with governance in the organization. And then lastly, although they did not pay much attention to the technical aspects of our work, the programs that we ran, they did make an observation that our technical team was almost like a pyramid shape, where at the top we had very few highly experienced technical people, and at the bottom we had a huge number of low to medium experienced people doing work in the field. And I'll talk to this point later on when I share what the successes and challenges have been and why this may be important for colleagues that are working in this area. So in terms of institutional strengthening, we divided our work into 3 areas: short, medium, long. So for short, this is basically 12 months work that we had to do to strengthen the organization, to get us firmly on the path to becoming a USG recipient. So when we looked at some of the things that were established in that assessment, we organized them around what we called mini or micro projects. This was to recognize that the kind of remedial work we needed to do was temporary and not long-term. And so if we organize it around the project component or concept rather, it would help us with the change management in terms of some of the tools that would bring in the way we would change our processes in that regard. And that really worked very well for us. And then in terms of work that we had to do within a 2 to 3 year period, which is the medium term, that really focused on getting us firmly to becoming a USG recipient. So we had then to address the issue of the kind of organization we are as in a not-for-profit, as an NGO. So what we did was really to strengthen that identity in being a not-for-profit. And it allowed us then to be able to bid successfully and compete with NGOs without having been labeled as a private organization. And then, as I mentioned earlier on, we were identified to have very few technical people at the top and a lot of medium to low level personnel at the bottom. So that spoke to our staff recruitment and retention strategy for the organization. It required us to review the portfolio of work that we have, as well as the kind of strategies that we had around remuneration to be able to attract the kinds of people that we needed. And then of course, also we had to look at the number of projects that we had and to address the increase in that. Then the long-term view was basically to diversify the funding, to increase the number of projects that we have that are non-USG funded in that regard. So what were the successes and challenges that we experienced? So in terms of success, so by the end of the project, the BLC project, they did the post-test using the same tool and measured the progress that we had achieved on the same processes. And of course, we were very grateful and lucky to say we worked hard and we were recommended to graduate. Specifically, one of the things that I think will be critical for organizations that are thinking of working in this space is to ask yourself a question. For all the strengthening activities that will be done, what is it that you can demonstrate practically as evidence of your financial systems becoming strong in that regard to be able to manage USG funding? So from 2011 up to date, we've been able to conduct statutory audits and one A133 audit successfully back to back. That really counted a lot when USAID was assessing us in making a determination whether they should award us directly. So it's something that organizations that are working in this space need to think about. My experience has shown that when it comes to capacity building efforts, organizations do get strengthening technical assistance from the organization that provides that support. But what is the proof? So the pre and post that the capacity building organization does often for me is not enough. I mean, the feedback that we got from USAID was such that the evidence that we had undergone audits really is what just made them feel very comfortable that this organization knows what it's doing. So between 2011 and 2014, IHM averaged $300,000 in terms of annual funding. But once we graduated and we got funding from the US government, in fact, our first grant in 2015 was 1.2 million. Around about the same time, we were able to bid and successfully win a project from the World Bank. And again, the feedback we got was one of the reasons why we're able to get this funding from the World Bank was because of the work that we have done with MSH and the fact that we have become a direct recipient to US funding. then, of course, upon graduation, also our project portfolio increased, both in the 3 countries that I've listed there, Swaziland, Lesotho, and Zambia. With graduation and growth, of course, comes its own types of challenges that we've experienced since then. Diversification is a major challenge. We keep hearing that we cannot just rely on USG funding. We've gotten money from the World Bank and the Global Fund, but there's need to increase the proportions of this funding in comparison to USG funding. And then we've also been asking ourselves a question in relation to diversification, whether we would want to continue being a not-for-profit or then venture into the social enterprise space. It's a conversation that is interesting, that has got several implications on what we do, but we feel that this is something that we want to venture into as we continue contemplating how we make an impact in the space that we play in. Then in terms of recruitment, there's been debates around why the localization strategy is being pursued by USAID and by OGAC broadly. And one of those is that it's quite expensive to deliver aid through the established international NGOs. But our experience has shown us that as we try to attract colleagues to come and join us, they don't come cheap, particularly colleagues that have more than 15 years experience and with qualifications of masters and above. Yeah, they don't come cheap. They're quite costly on the budgeting. So whenever we've put these bids together to try to diversify our funding, we found that there's a balance you need to strike on the kinds of people that you bring on board. And then of course, there's this argument that we are also finding that colleagues are advancing to us, which is as we try to bring in talent from other countries into different countries, the experiences that they've had working for these big NGOs as experts comes into play, and that makes it very, very expensive. And so as we work then within the countries, one of the things that we're looking at is just focusing on the expertise within the country. And then we see where we can balance it with 1 or 2 individuals that come from other countries to strengthen the talent pool that we have. Even within countries, one of the things that we found, and it would be interesting to hear what other colleagues share, even within a country where you want to just recruit locally, we find that still there are colleagues that have come from contexts like the UN, they've worked for big organizations like the big ones, JSI, FHI, MSH, etc. Not that I'm singling them out, but just as examples. We find that they're quite expensive. And so I just want to caution to say, while we push for local, it's not always going to be easy and straightforward to say local is affordable. We don't think that it is, which then brings into play the whole idea of developing staff that may not necessarily have the experience, but may have the qualifications of these much more expensive colleagues, growing them to be able to occupy these positions. So what have we learned, and what are my parting thoughts that I'd like to share with colleagues in this regard? Bearing in mind that there's 3 of us, I'd like to make this as brief as possible. So there's 2 things I'd like to share with colleagues that are looking at building their capacity to become a USG recipient. We worked very hard to develop both the operations and the program side of things. But often when the assessments are done, the focus is mainly on financial management and compliance, with the understanding that the organization that is pushing for US government funding has got technical capabilities in this regard. And so as you then want to focus on your financial management, please pay attention to those 2 things, your accounting systems, and if I can underline and over-underline audits. Some of the arguments I've heard from colleagues that I've met in the region in Southern Africa as I travel around, they've pointed out that audits are not cheap. But what we found out is that actually audit companies have got 2 types of rates for not-for-profits and for private companies. And so when you clearly approach them as a not-for-profit, as an NGO, they do charge significantly lower. And for your audits, you have to get established firms, not just any wishy-washy firm out there. Because when USAID comes, they normally have the names of those established audit firms, sorry. And so when you do your audits with those kinds of firms, it carries a lot of mileage in terms of them considering you for funding. The other area is compliance. If I was given a choice, I would say on a scale of 0 to 10, I think financial management takes about 80% of the requirements and compliance 20%. But that's where the catch is. The 20% looks small, but it's so critical. It has actually led to organizations losing funding from the US government, and in some cases getting blacklisted. So please get yourselves trained. The number of organizations that provide this. IHM personally, I mean, we benefited from Inside NGO. I noticed that they've changed their name. I don't know what they're called now, but a couple of vendors that are well known and they provide excellent training on rules and regulations, which then closely relates to issues around procurement and logistics. So that's going to be very critical. And then lastly, while we push for becoming a direct recipient, I think one of the things I've noticed is that not many people appreciate the challenges that come with accepting US funding. We knew what this space is like. We were mentally prepared. Our organizational philosophies are in tune with this kind of funding. So while it was a bit onerous, for us, this is something that we looked towards. But I've noticed that a number of people are not aware of the onerous requirements and the toll that comes with accepting USG funding. And so there's need for that organizational introspection to happen and be clear about it and make a decision and go for it. Otherwise, it can be a very painful experience. And when you fail to meet the requirements and you get blacklisted, it's not something that you can easily bounce back from. It can affect you for many years to come. So this is something that people need to think about. And then lastly for us, when we started IHM, we had put together a strategic plan. This was key for us because it's the one thing that has allowed us, whenever we felt confused or in doubt about the decisions, we would always go back to the strategic plan, and that would be the basis upon which we would make choices as an organization in which direction to move, where to make investments, and in this case, why we chose USG funding. So basically, this is my presentation on what the experiences has been. I will stop here. Thank you. Chris?
Thank you very much. That was really interesting. I really appreciate it. We're going to turn the floor over to Stephanie Watson-Grant and Ambrose for the second presentation, and then we'll open it up for more discussion. And I noticed that some people are putting things in the question and answer box, which is great, and we'll get to those shortly. Thank you.
Thank you, Heidi, and good day to everyone. A few years ago, Measure Evaluation developed guidance for creating capacity building plans. This was in keeping with the project's mandate to improve the capacity of local partners to independently implement an evaluation. So we decided to understand what a capacity planning process would look like and apply this in a very practical way. So in order to develop a plan, we first needed to know what we were planning for. We needed to understand what the existing capacity is, evaluation capacity, and the areas of strengthening that would be included in the plan. So we developed a framework for evaluation capacity strengthening, and it has 4 domains and many different components. And the 4 main domains are human resources, organizational resources, technology, data collection, analysis, and use. In human resources, this relates to staffing, evaluation, design, and leadership. And staffing focuses on optimal staff contingent relating to both numbers and skills and their designated roles. The evaluation design pertains to the substantive contribution of the team during the design phase of the evaluation and the standard operating procedures for the evaluation. An example of leadership is an individual or individuals with strong evaluation and management background who leads the designated team. Organizational resources relate to operations management, communication, work plan development. So here we're looking at proper survey budgeting, documentation, sharing of procurement processes. Communication pertains to the products and the mechanisms that deliver clear and transparent messages and the trust that the team enjoys with the entity that they're affiliated with. The work plan development describes and provides an implementation timeline for all activities as outlined in terms of reference with staff responsibilities. Technology relates to electronic data capture and storage, as well as analytic tools and skills. So for example, the development of electronic questionnaires. A component of the analysis tools and skills also includes qualitative and quantitative data analysis, software, and skills where appropriate. Data collection, analysis, and use includes fieldwork planning, data collection, data analysis, report writing, and data dissemination. So fieldwork planning includes standard operating procedure manuals, sensitization of local communities and logistics. Data collection includes daily schedules, courtesy port protocols. Data analysis and report writing focuses on data file management, analysis plan development, and writing in a well-structured manner with precise language that communicates effectively. And then data dissemination relates to the development of products such as briefs, multimedia products, with clearly crafted messages for different audiences. So the toolkit that we developed has a few points to it. So it includes a facilitator's guide to help structure the assessment and the planning process, an interview guide with guiding questions, a rating score that chaperones a conversation about evaluation capacity for each of the components, and at the end of the conversation, areas that could benefit from capacity enhancement are identified. And then the capacity plan is a simple planning matrix that includes statement of the capacity gap, what interventions will be implemented by whom and when, and what benchmarks are to be met. So we've approached this very simply. That is, evaluation capacity is enhanced when the interventions are completed and benchmarks are met. So we piloted this toolkit in 5 countries, and I'm going to invite Dr. Ambrose Aguayu to talk about his experience with this process and the tools in Kenya. Ambrose?
Good afternoon, everyone. Good morning for those in the US. And thank you, Stephanie and Heidi and all others who are involved in organizing this, for giving us the opportunity to share our experiences working with measure evaluation as users of this toolkit for strengthening evaluation capacity. I'm proud to be presenting this on behalf of a large team, and I know some of them have logged in to listen in on this, so I hope I do you all justice. Stephanie, will you move to the next slide for me, please? Thanks. So HealthStrat is an indigenous Kenyan public health organization. We were incorporated around 8 years ago, and we specialize in implementing innovative health system solutions. Over the 8 or so years we've been around, we've managed to work hard to establish a rich portfolio of projects around a range of aspects of health system strengthening. Our focus has been in HIV and TB programming, but we also have a general interest in health service delivery, working with counties and national government to strengthen leaders, supporting local organizations to manage grants. We have work around human resources for health, supply chain management, and of course, healthcare evaluation. Over the years, we've grown from a small team to now over 400 staff members distributed across the country. And we have now a range of organizations which provide funding for our projects, including PEPFAR through USAID and CDC, and other partners who are listed on the slide. So feel that we've managed to, over the years, demonstrate favorable clinical outcomes for the patients within our programs, and we think we've done so efficiently as well. Next slide, please. So our work with measure evaluation stems from a competitively awarded grant where we were awarded as a local partner to support a mixed method study. And this project was organized in 2 phases, and it involved both DQAs, data quality assessments, in 182 sites across Kenya, and key informant interviews with respondents from both national and county level. In addition to data collection as HealthStrat, we were responsible for submission of the protocol for IRB approval, county engagement, data extraction from the routine health information system, and the equivalent database for tuberculosis care and treatment. And then we worked together with measure evaluation, disseminating the findings for the study. So we undertook the study in 2 phases, spanning a period of just over 1 year. Data collection took place in January and February 2017 for the first phase, after which we then went through use of this evaluation capacity strengthening tool, and then implemented actions from that exercise, went into data collection for phase 2 a year later, and then revisited the discussions around the tool with the measure evaluation team, which we were working with. Next slide, please. So Stephanie's already talked a bit about the structure of the tool. So we identify 5 general steps in using the tool, defining the purpose with the partner who is facilitating the discussions around evaluation capacity strengthening, and then reviewing the capacity areas, and then having a discussion around strengths and gaps from that initial review of these domains which Stephanie referred to, reflection and self-rating, where us as users of the tool would then assign ourselves a subjective assessment of our performance, and then from this rating exercise, define priority actions with tangible outputs. The 4 broad domains, as Stephanie outlined earlier, we had very useful feedback and discussions from all 4, but because of time, I'll focus on our experiences related to data collection, analysis, and use, and technology. Next slide, please. So regarding data collection, analysis, and use, we identified a few challenges after our initial first round of data collection. So first, as I mentioned, this was a large national study requiring field teams to work in series across the country. Our team of research assistants was relatively inexperienced conducting field research, and going into the project, we didn't have standardized guidance for procedures or logistics. So we worked together with measure evaluation to co-design a manual contextualized for the study. We worked together to train research assistants on using the manuals in the field, and ultimately, in the second round of field work, we experienced a much smoother data collection process than we did during the first phase. Next slide, please. The second priority action was around use of technology. And here I'd like to highlight our proposition to measure evaluation to use a mobile-based tool for both data capture and reporting. So HealthStrat have an in-house customized mobile-based application for healthcare evaluations called QualiCare 360. So based on this experience, we propose to use tablets in the field for data capture and reporting. So in the field, we realized that the time allocated for development may have been inadequate, and research assistants in the field at times reported challenges using the tool. So the process of troubleshooting was both inefficient and extremely demanding on the coordinating team. So again, we worked together with Measure Evaluation to brainstorm on how to address this challenge. And one of the key outputs was developing, again, customized SOPs for data capture using a tool which was developed in ComCare, and adapting the Excel-based RDQA tool from Measure Evaluation into this ComCare tool running on the tablets, which were then used in the field. So during this second round of data capture, we experienced, again, enhanced efficiency during data collection, and we felt that even queries around data quality reduced substantially during this second round. Next slide, please. I'd now like to highlight just a few of the new relevant projects which HealthStrat has been involved in, and I think we've applied the experiences gained from the capacity strengthening exercise. The first is a qualitative study we undertook in partnership with ICF through funding sub-awarded from USAID. And this study took place in 6 counties in Kenya, and we were looking at factors influencing the place of delivery among women in the community. We adapted the field manual from the initial capacity strengthening exercise and applied a lot of the principles from the other domains in the capacity assessment tool during this process. The second illustration is an endline evaluation, which we're currently undertaking for a 5-year PEPFAR CDC funded grant awarded to HealthStrat as the prime recipient to support HIV care and treatment services in 108 Kenya prisons. And we are using the principles within the capacity assessment tool to work as a team to develop a clear process for this evaluation, including fieldwork planning, designing the evaluation itself, and hopefully once we get the findings, we will be able to also apply some of those principles linked to activities such as dissemination. And the final example is this new project which HealthStrat is a sub-recipient receiving funding for a large HIV program in Western Kenya of over 32,000 clients in care and treatment at 155 sites. And here, again, a lot of the operational and management processes within the capacity evaluation tool have proved useful in helping us think through how to execute a large program efficiently. Next slide, please. So the expanded range of projects which HealthStrat has been involved in is reflected in this graph, which shows both increased funding and a staff complement within our organization. So over the 5 years, we've been, the 5 years preceding this year. We've seen steady growth in funding, which we've managed to attract, and this in itself demands more efficient and structured processes for running operations, including those related to evaluation. And it's such growth that we feel demands use of tools such as this evaluation capacity strengthening tool to help local organizations better manage the increasing demands from growing projects. Next slide, please. So the tool evaluated us. Now, we think it's only fair to evaluate the tool as well. I'll end by providing an assessment of what we feel are the main strengths and limitations of the tool. So we worked together using this tool over 2 rounds of data collection. And I think we've seen a variety of tools and manuals for exercises similar to this, but our team found this one particularly user-friendly. If you go through the tool, you'll notice its intuitive design and your ability to adapt the tool to a range of settings. We've managed to use the tool internally as well, and with the teams which we work with to critically examine our strengths and gaps and address these ahead of projects which we're undertaking. We think that the tool was particularly useful in tracking progress over time. So where actions are defined, I think the tool was particularly useful in going back and examining whether the actions which were targeted were actually implemented. We think that there are some limitations to the tool, specifically the subjective nature of the scoring, which is particularly a challenge where you are only capturing data at one time point. So I think it's useful if you're using it to track progress, but again, a rating of excellent versus poor is hard to assess without a comparator. We also think that our success in using the tool was in many ways enhanced by the good working relationship which we had with the measure evaluation team. I think it would be very difficult to engage in an exercise where this tool is used and other tools are used where you don't have a genuine partnerships between the facilitating organization and the organization which is participating in the exercise. So overall, I'd say we had a very pleasant experience using the tool and with our partners. As an organization, we've witnessed significant growth over recent years, and I'm not claiming that this growth was attributed entirely to using this tool, but what we can say confidently is that the exercise prepared us to take on increasing roles and even cascade this capacity strengthening to individuals and teams which we're working with. So I'll end there. This is the next slide. And on behalf of the Health Strat team, only a few of whom are on this slide, I'll say thank you very much.
Thank you very much, Ambrose. Very much appreciated. We're going to switch over now to questions and answers. I think what I'll do is it looks like right now there's about 11 questions and comments in the Q&A box. And I think I'll try to read 2 or 3 at a time and then open it up to you all to respond to the ones that are most relevant to your experience. So to start with, the first one is from Matrida Simfukwe. She says, if the organization is working with many partners and the assessment results show different levels of capacity of the partners, what is the best approach, which is cost and time efficient, to improve capacities? So dealing with some of the complexity there. And then Amita Malhotra says, were there certain criteria or milestones that needed to be met prior to graduation, or did everybody eventually graduate? So I think that question about what it took to graduate is an important one. And then Judy Seltzer from MSH acknowledges that she met you all probably 4 to 5 years ago, IHM, and would like to offer some new advancements with both the MSH OCA and the USAID OCA and the NUPIS. So perhaps either Judy or somebody else can comment on what those might be. Why don't I stop there and open it up to Ambrose, Kelvin, and Stephanie. Graduation. Kelvin, do you think you could address that graduation question about what was the criteria to graduate?
Okay, thank you, Heidi. So the OCA, you need to score above 7 on all the key areas that are identified in that OCA. That's one. And then secondly, the assessments that were done were meant to demonstrate that IHM has growing capacity. But one other thing is USAID does not do the actual assessment itself, which is independent. They hire they approved service providers, and in our case for Southern Africa, they're called sustainability solutions. They're accredited to the mission, basically, and they're the ones that do the final assessment to make sure that, one, you've got accounting systems in place that can meet the rules and regulations. And then two, you've got the governance measures in place. And for us, really what worked very well, like I said, was that it was just not a question of demonstrating that we have these in place, but that we've actually used these things, if I can put it that way. In other words, we've got organizational experience in managing funds. And the simplest way we could have done that was to have organizational audits because they demonstrate that you are managing funds. So the audits that we had are statutory audits that comply with generally acceptable accounting practices. So if you work with one of these organizations that use these tools, the scoring for us was 7. Anything below 7 was not acceptable. We had to score above 7. And so where we did not score above 7, those are the areas that we worked in to take us above 7. And then once we were able to score above 7 comfortably, in terms of the post-test, then MSH brought in sustainability solutions that then did an independent assessment and then wrote a report to USAID to say, we're happy with what we've seen with IHM, you can go ahead and give them a direct award. I hope that helps.
Thank you.
Right, I can take a stab at the first question, which is which asked about organizations at different levels of capacity. And I think all of these tools and processes, the OCA, the evaluation capacity strengthening tool, they're all customizable, or they're able to meet the organization at the capacity level that they are. And the whole purpose is to go through a process of identifying what the capacity level of the organization is and identify where that organization wants to get to and work with the organization to get to that goal, that capacity goal. So it really, all of these processes are intended to meet the organizations at whatever capacity level they are, and depending on what the organization wants to do or what their goals are, is to you know, there may be a process that helps that organization get to that goal.
Thank you. I thought too that Kelvin's comment about the strategic plan really guiding your, would help you narrow and focus on what you want to build was important. Okay, so we're going to keep going, but I'm going to just recognize that we're about 3 minutes before the top of the hour, and we will stick around to try to answer some questions for a few minutes after the hour because there are some more here, just to acknowledge that we'll keep going for a little while. So there is a question here, a couple of questions from Shelley Trim. Did you get the local expertise needed from the country, and how did you handle that recruitment? And then a specific question for Ambrose. What did you do in terms of disseminating the results, and how much did that cost? And then I'll do, I'll do a third question. I'm a little bit concerned I might not understand it from, and I'm gonna not, I apologize for the pronunciation, Draker Penka Gomez. Has this tool a check face over relationship between the facilitator and participant? So I think commenting a little bit on the relationship, between the facilitator and the participant would be helpful.
Some Ambrose questions.
Yeah.
We should just give the time to Ambrose.
Ambrose, you want to try to address some of those? How did you get the local expertise needed? Well, that was, I think Kelvin was commenting on that too, but then what did you do in terms of disseminating the results, and how much did it cost? You see, Ambrose, are you unmuted?
Sorry, I think I was muted.
Okay.
As far as disseminating results, so HealthStrat has a central office and then regional teams across the country. And we've, over the years, worked hard to build strong relations with stakeholders at both the national government level, partners, development partners, and county governments. Kenya has 47 devolved counties now, which operate as semi-autonomous units. So we've worked together to map those stakeholders and establish good relations with them. And they were the audience for this dissemination. So we essentially reached out to them and arranged for a centralized meeting where we shared results with them through presentations, but I think more importantly, managed to have smaller breakout sessions where we discussed the findings of the study and managed to capture additional information that was to feed into the final report. So it was a single centralized meeting, and it involved a range of stakeholders who we've managed to establish relations with over time. So I think the question about identifying partners with adequate capacity to use the tool, probably as the users, we wouldn't necessarily be the right person to be answering this question for what I presented, but we have used the tool internally, and even with the partners who we're working with on, for example, the end-line evaluation, to plan and implement field work and data collection and analysis and reporting of results. And again, goes back to the point where I said, I think one strength of the evaluation capacity strengthening tool that we used is its adaptability and ability to use it across a whole range of users, spanning highly experienced organizations to new users of people who are undertaking evaluations for the first time or participating in data collection for the first time as well. Over.
Thank you, Ambrose. Sorry, I didn't realize we were muted. But I want to. There's a question here from Sophia Durrani, which I thought it was an interesting one. I had a similar question, and I think it was Kelvin that was talking about this issue between, local talent versus hiring some of the, from some of the other larger organizations that may be, and there's this affordability question. But so outside of this issue of affordability, how do you find that there's local talent in the market? And what are your concerns or hesitations about investing in skills training for staff that might not invest back into IHM in terms of retention? So, right, like you build their skills and maybe they leave or something like that. So how do you deal with that internally to the organization?
Okay, interesting question. So first of all, I believe that whatever we invest in as an organization into individuals is not just for IHM, it's for the country where we're doing the work. So if we lose a person, for us, we don't see it as a loss, but a gain for the country, because then they can move on to do better work elsewhere over and above what they've done. So our philosophy around this has been interesting. We want a situation, and we've already begun experiencing it, where when colleagues that want to leave the organization, we want them to go for a higher position in a bigger context. So that requires us to be willing to accept that we will lose people, one. That also requires us to recognize that the work that we do is good enough for a person to grow and be attracted by better context than ours. So in recognizing that, we've not been afraid of making those kinds of investments. I personally learned this approach from, there's a colleague I met a while ago, I forget her name, she used to work for AMREF. And she used to say to us that when colleagues leave AMREF, their observation is that they normally go for bigger and better positions in big organizations. And what that has led to is those organizations, whenever they look for a local partner, they come back to AMREF based on their experiences. So we've embraced that kind of philosophy and thinking in terms of developing our capacity. That then speaks to a number of things in your organization, the organizational culture, how you manage people, whether you create challenging opportunities for them, et cetera, et cetera. And so those are some of the things that we constantly work on in IHM to get ourselves in a position where we know when we bring colleagues that would want to stay, that's one. And two, if they've been with us and they've grown, we can all see to say this person has outgrown their portfolio and we need to help them get to the next level, because IHM can't provide that. And then coming to the issue of finding local expertise. So there's two types of scenarios when it comes to local expertise. So you've got colleagues on the ground that have limited experience in terms of the context that they've worked in, and for the organizations that they work in, they haven't done much. And then you've got those you've got colleagues that have worked across organizations and may have had an opportunity to actually go out of the country and they're back. Those are the ones that are normally expensive. But also what we've recognized is that there's a growing pool of talent within the region that has worked in these big organizations and that have made themselves available and are willing to work in another country. And they normally come with very interesting experience of working in one or two countries. That makes it very strong for you when you're bidding for opportunities. And that's the balance that you just need to work out carefully. To say, how many people do I bring on board? Interestingly, one of the things that we are learning in terms of the change in the way the funding landscape is moving in terms of local organizations. When, as you know, there's this deliberate effort to bring on board local organizations to bid. So we had an interesting experience in Lesotho where we actually were invited to go and present our proposal. And the invitation required that we bring the 4 key personnel: chief of party, deputy chief of party, technical director, and the finance person. And there was need to demonstrate commitment that these people are on the ground and they're going to be available when the project is awarded. What that showed us was that it's going to get more harder because there's a tendency to just use CVs to go for these bids. I think you're better placed to think carefully around that. So while we struggle to actually find very good people locally, now there's even going to be more pressure from the US government to show that the kinds of people that you're putting on your bids are actually available to do this kind of work. So there are those challenges. So did we find these people locally? Yes, we've been able to find them, and we've been able to use some of them. In the smaller context of Swaziland and Lesotho, it's been a bit difficult. The talent pool is smaller, but in South Africa and Zambia, the talent pool is quite big. We found that it's much easier to find people in these countries than in the smaller countries. So I don't know how the dynamics are going to play, but I think in a country where you've got a significantly smaller population, you're going to find that challenge of getting the right people locally that can do this work. Whereas in the bigger population countries, your Kenya, Nigeria, etc., I don't think you will struggle to find people to do this kind of work. It's just a question of finding the right pricing that you would put in your proposal in that regard.
Thank you, Kelvin. Before we end, Ambrose, is there anything you would like to add on that topic, finding local talent or retaining local talent in your organization?
Thanks. I completely agree with Kelvin's thoughts. I guess there is a paradox in that the more the local talent you have, in a sense, the more mobile that local talent is. So I think one thing in organizations like ours and others in countries like Kenya is retaining talent becomes increasingly challenging with an expanding demand for that talent in other countries around the region, which are experiencing shortages in that resource. But I completely agree with Kelvin's point regarding that being viewed as a strength and an opportunity, as opposed to viewing it negatively, in that all it does is expand the organization's networks and opens up opportunities which might otherwise not have been experienced. I think it's critical that the resource which is leaving for those quote-unquote greener pastures leaves and carries a legacy or the culture, an organizational culture from our organization, and then essentially transplants it there and allows us to spread our influence both directly and indirectly through their mobility.
Great, thank you, Ambrose. There are a couple of other questions that have come in at this time related to data demand and use and the level of institutionalization and implementation of data culture in the countries where the studies are done. And then there's a question about the different types of capacity and government levels, political, administrative, and financial autonomy. What are the governance arrangements in these cases to realize monitoring and evaluation, particularly to retain human resources? And I want to acknowledge and thank you for your questions, but given the time, I think what we're going to do is answer those offline, and then turn to thanking our presenters once again, Kelvin Sikwebele from IHM, Ambrose Egweyu from HealthStrat, and Stephanie Watson-Grant of Measure Evaluation. I really appreciate your time today and the participants' time, and this has been very interesting. And once again, two reminders. One is that the webinar will be made available for listening and watching again. We'll send it out to all people who registered. And then there will be a French webinar, a similar topic, different cases, different organizations on July 18th. So look forward to an announcement about that. All right, well, thank you, everybody. Thank you.
Thank you. Thank you.
Thank you very much.